great to be here at HIMSS in Vegas. And Olga, you're here and you brought a special guest.
Yes, awesome.
Hi, Nilesh Bhandari. Thanks so much for having us here.
Yeah, great to be here. Would you quickly introduce yourself too?
Yeah, absolutely. I'm Olga Muller, and I'm here with a small engineering company called Kepler Team. We specialize on devising digital health products with startups and integration practices. Basically, we're that innovation lab.
Awesome.
Growing new products.
And we're going to really talk about what is so difficult for startups with interoperability, and you're really solving that. I mean, you have experience as well.
Yes, absolutely. And one of the things that we've seen in our network is how much that lack of interoperability affecting the success for companies early stage, where there's plenty of point solutions out there, but unless they integrate it into provider workflows, they really don't get that traction that is absolutely crucial for their success early on. And Nilesh, I'm sure, is able to talk about his firsthand experience with that.
Absolutely. So we've got a company called Advanced Health Academy. We look at lab results and they come back into whatever workflow there may be clinically. And as part of that today, there's really no simple way to be able to think about how that interpretation gets standardized across the board. But the very interesting thing there is there's a clinical aspect, there's an operational workflow aspect where it needs to fit right in, right, within the different EHRs and the different practice management. But then also downstream, when we think about the financial workflows, what does the revenue cycle management process look like? How do we pull across those things? Today, we've got different systems across any medical system that's working with all of it, and they've worked very hard to make those interoperate or be able to at least have look and views back and forth. But when we think about data and how critically important it is to drive decision making across all these elements, how do we standardize across all that? That's where the Kepler team has been incredibly helpful. That's where others are trying to help bridge those gaps. But when we've got different pieces of ownership across those, boy, oh boy, that is very challenging.
And I'm not that smart, but I can see that's a serious problem because I'm thinking me as a consumer, patient, getting my lab results, but it's a dynamic process. And then the clinician, all right, which ones need to be actionable? How do they actually know what value to then move the needle? So I can imagine hence you guys working
Absolutely.
that. Yeah.
Exactly.
The great irony is that we've got something that is completely unique in the marketplace. And so there is no standard category that you would find across the floor here to say, wait, amongst this, how is this one faster, cheaper, better? So when there's new innovations, where new category creation, breaking into not only creating the visibility around it, even though every stakeholder says there's immense value here, but then secondly, how to then bring those into those workflows and make it interoperable. That's the second piece of the challenge that is really daunting for most young companies and innovative solutions out there.
So when you work with labs, are you working with provider groups? Are you working with payers, health systems? I mean, that's a whole...
So the simple answer is yes, predominantly provider groups and health systems, because that's where the clinical, operational, and financial benefit lies.
Okay.
Also working with payers, but that's a completely separate process. Let's keep that off the table. But we also want to make sure at the end of the day, we're trying to drive better self-empowerment for the patient and better clinical outcomes. That is first and foremost where we're driving capability here.
And talking about startups, what would you recommend to startups as they get going?
So one of the things, for a while, we were trying to tackle that specific problem. And of course, there's a multi-component answer to that, right? So our expertise comes from, it depends on where they are. How do we approach that? If you think about prototyping, if you think about what MVP should look like, the main question is not what should be included, but what shouldn't be included. And that's the hardest problem to solve. But then one of the things we figured out is a lot of times our winning solutions that we would consider them winning come as a point solution to providers, and those doors just don't open. And to us, we were looking for all types of solutions that could help startups. Most of them were outside of the startups' budgets. So we ended up creating our own solution just so that we could play in there. And that is, we called it EMRAY, EMR Ray. And it basically is a smart on fire application that allows for us to connect startups such as Nilesh with the EHR data, and in a non-invasive way that is efficient, that is inexpensive, and that is targeted specifically for startups to help them start it, to help them get that initial integration before they go and most likely will become part of this much deeper operational systems, right?
I'll give both perspectives on it. So absolutely,
Yeah.
On that side, from a startup perspective, incredibly valuable. But the other side where it's incredibly valuable, if you talk to any health system out there, they're looking for innovations to help in every one of these different aspects. Well, how do they help integrate those processes? And how do they initially test out those sort of new innovations? Well, so I have a platform like MRay where I would say, great, here's a platform that can just pull the data,
Yep.
have a sidebar system there to go run it for a little bit to say, is there appropriate value for this specific situation? That is incredibly valuable. So I'll say that part has been incredibly valuable. The other element that I think I would advise startups is figure out the business model. Where is their value
Yes.
and where is potentially taking value away from? Because they understand where the benefits are, but where the drawbacks may be, where the resistance points may be, and then tackle that head on. But do that in a way that also integrates the technology and operational elements to make that really cohesive overall. That, I think, is part of the secret sauce here.
As we're at HIMSS, anything you guys are really excited about, feeling like partners, opportunities, or hype, or
You go.
A number of areas. I'll say that this is probably the first year that I can think about in my sort of 15 years of being here, where there is real excitement for taking on new innovation. Now, I'm saying innovation more broadly. Let's be clear. Everyone behind us here is probably talking AI in some way, shape, or form, and historically there's been a lot of resistance towards it. But I think now there's acceptance towards, yes, AI is going to help a fair amount, and not just AI, that broadens up the entire innovation bucket overall. But in addition to furthermore, it is driving how do they test and try different new innovations. And everyone recognizes that the current systems that we have in place are not driving the outcomes we want, whether it be patient outcomes, whether it be clinical outcomes, or financial outcomes for health systems. And so to being open to this to drive greater efficiency across all those elements, this is the first time I feel real excitement and a forward-leaning stance towards it, not a resistance towards it. So I think that's amazing.
It is. Well, to me also, I see that there is that merge between outside innovation and inside innovation, and that healthcare systems are more open to talking about, for example, our experience 10 years working with startups in digital health. That experience becomes just now relevant to healthcare systems because they realize they don't have it internally. And on the other hand, I feel that there's my personal way of getting excited as we finally are talking about regulations on different levels with AI, and something we should have been talking about for probably last several years. But at least I see a lot of conversations where those regulations and this understanding of this fast-growing technology, how fast it's outgrowing everything that we had created up to date, and how really there's kind of dangers in that, and we really should be looking to what is the definition between our relationship between AI and what we're creating. So to me, these are super important conversations, really. It's better that they're happening now than never, and I'd love to, and I'm finding ways to actually be part of those conversations.
Yeah, I love what you brought up, and a lot of our conversations we've had is the word governance has been bringing up a lot, and a lot of these companies are being very forward-looking, trying to get it right because there's so many different ways to do this AI, the cost effectiveness, not whether to use it or not use, just.
I think the hard part is as human beings, we think about growth in a linear fashion when we know growth is truly an exponential function, and we are literally at that tail, that exponential function. We're going to see that incredible rise, and we're seeing it, everyone admitting that now in a much bigger way, and now the question is how to get on top of that. So I am very excited about where medicine can go if we have the openness towards it and the type of outcomes we can drive globally to really drive human health.
Well, as we wrap up, please let people know how they can find both of you, a little bit about your, just.
Yeah, you can always find us on LinkedIn. That's probably my go-to tool. Just type Olga Muller and you'll find my profile, and happy to connect. I'm also building community in North Carolina and excited about some of the collaborations we have with some really prominent healthcare systems to bring that community together to create some of the more startup pitch competitions and some other events. Something that, again, is on my horizon. So if you are a startup or somebody working with startups, absolutely, I always like to pay it forward. My resources are yours. Anything to do with, I probably talk to at least, dozens of different innovators every month. So very familiar with what's happening on the market, and I'm always happy to provide that advice, what could be useful.
And please reach out anytime, Nilesh Bhandari, and look up our website, ahealthacademy.com, or reach out to me directly, Nilesh, Nilesh, @ahealthacademy.com. happy to look into your specific situation and see how we can help across the board.
Awesome.
Thanks so much. Really appreciate it.
Thank you for having us.
It's a
Thank
pleasure,
you.
as
Awesome.
always.
Yeah,
Thank
awesome.
you.